All right, so February is American Heart Month. A recent study from the American Heart Association shows a top health risk is on the rise, but the victims may actually surprise you. It's young women.
Here to discuss the risk of heart disease, the rising risk, and how to prevent it is Dr. Vangala, a cardiologist from Pomona Valley Hospital. Good morning, Dr. Vangala. We appreciate you being here.
Good morning. Thank you for having me.
Years ago, I did a story about the silent killer. A lot of people don't think that cardiac disease, heart disease would affect women, and that's exactly the case.
Yeah, I think a common myth is, I'm too young to have a heart attack, or I'm too active to have a heart attack. And I think a lot of times we forget that, it is not an old man's disease. It can actually affect a lot of younger people, and mainly females too, and we kind of under-recognize that.
Do you think women just don't recognize the symptoms, or they just don't want to? What is it about women that they don't acknowledge it?
It's interesting. We don't really know the answer to that. We may never know, but I think one of the main things is awareness. And I think it's interesting, there's a recent study that showed that in a survey of females, 50% of females realize that heart disease is the #1 killer of females, but only 13% realize that it's a risk to them. So I think a lot of it is awareness in terms of getting yourself checked.
Heart disease runs, in families. Does that mean, people, they're concerned it could happen to them, because their family has it? Is it a lot of genes related?
Right, and that's a great question, and that's another common myth, is that a lot of people feel my father had heart disease, so I'm pretty much due to have heart disease, and that's really not true. Heart disease is a preventable condition, and we can definitely prevent it if we take the right steps and monitor ourselves and do things like that.
You kind of touched on this, that people think that if you're active, if you're healthy, if you're in great shape, you're not going to get a heart attack.
Right. So heart disease involves a lot of different aspects, and being active is definitely one of them. But there's a lot of other parts of it as well that can help prevent a heart attack.
Signs of heart attack are sudden and intense. So if you're at home right now, what are the warning signs?
So most commonly, people know about chest pressure or pain that goes to the left arm, and that is the most common symptom. But particularly in females, it doesn't have to be just that. It could be shortness of breath, it could be neck pain, it could be back pain, it could be a very number of symptoms. And I always tell people, you know yourself better than any of us do. So anything that's uncomfortable for you, you always should get checked out.
I heard somebody tell me once that they threw up. They had like really violent nausea.
Right.
And then felt the pressure. Is that one of the symptoms as well?
Sure, yeah. There's a lot of varied symptoms. That could be one. Some people have flu-like symptoms, and they can develop heart disease from that. Even stress, very stressful situations can cause that. So there's a lot of different things that can really precipitate a heart attack. So it's very important to really get those symptoms evaluated and checked.
Is there something that you can do as like a family member to just be aware of those symptoms? Like, what do you look for when it's not you, but somebody else?
So I think it's mainly education. So mainly it's knowing, this shortness of breath is out of the ordinary for me, or this chest pain is out of the ordinary for my family member. So it's one of those things, recognizing those symptoms in yourself and in your family members.
Okay, I'm having a hard time breathing right now.
That's okay.
I'm like, that's because I'm holding my breath.
Recently,
You're making me nervous.
This week, a study came out about diet sodas, about stroke. Is that related to heart disease as well? I mean, that study?
They formed a causation, but not a direct link between diet, soft drinks, and heart disease and stroke. But at the same time, I think everything in moderation is okay. I think one of the things that you do in trying to lose weight is find something that you can sustain and keep going. A lot of people try to find diets for the quick fix, but what you really want to do is find a balanced diet combination with exercise to really kind of help prevent your risk of heart disease.
And also just regularly seeing your doctor.
Right, and that's one of the big aspects, is really everyone should know what their blood pressure is, what their cholesterol is. There's really no reason not to. So we all should be aware of our own risk factors.
Women, how do they lower their risk of heart disease?
So I think it's funny. I think with women, in my personal experience, I feel like women inherently care more about others than themselves. So a very common scenario for me is the busy mom who's working, taking care of her kids. She may underappreciate the shortness of breath she gets with her morning jog, or the vague chest pain she gets with her daily, work. So those are symptoms that you really should get kind of checked out. It may not, fit in with the busy day that she has. So it's a very common scenario that we get.
So those symptoms can go on they can last for days or weeks before you actually have a heart attack?
Right, symptoms of a heart attack can come several months before. So you can feel fatigue, you can feel shortness of breath. One of the things I always tell patients to do is to exercise every day. So one of the reasons it's good is because it's good for your heart, but it's also good in terms of monitoring how well you're doing. So the person that's running 3 miles a day, and tells me, you know, I'm getting short of breath running 1 mile, that's a red flag to me. As opposed to someone who's not exercising at all, you'll never know if they really have any underlying heart condition.
Okay, he is now going to make me start go exercise.
I know, right?
And I'll take my blood pressure right now.
Can you take his blood pressure? Okay, Dr. Nathan Vangala, thank you so much for being here. You are a cardiologist from Pomona Valley Hospital. We really appreciate you taking time this weekend.
Thank you for having me.
Thank you.
A lot of smartness in the room right here.
I know, right?
A lot of smartness. Hopefully you learned something there. I certainly did.